Hello, my name's Josh. I'm one of the physiotherapists from My Physio SA, and today is another one of our educational series. And today I'll be talking about early shoulder exercises and what you can do to help with shoulder pain. So we're talking about shoulder pain today, but specifically more about sort of this chronic shoulder pain. It might not be there for a long time, but it's come on sort of without a serious injury or just with it's gradually came on over time and you're starting to notice pain around the shoulder. And particularly it will come on around the front part of the shoulder. So this is more likely to be caused by some impingement coming on around your shoulder, by altered movement patterns because of some imbalances through the muscle. The advice today is about this chronic shoulder problem, not something that we've had an acute injury where you've had a dislocation or a sporting injury. And if we're getting some impingement or imbalances around the shoulder, it changes the way that our shoulder moves. So as we're lifting up, we might start to impinge on some of the structures here, which can lead to pain and dysfunction in the shoulder. What's really important at this stage is you can do some things to help with that. And one of the exercises we do in this early stage, and you might even be able to do this before you come and see a physiotherapist, is to actually try and draw your shoulder blade back. So they're connected, and we want to try and draw this shoulder blade back in order to help try and facilitate some more room at the front. The other exercise we can do to help with your shoulder is to start to improve some of your rotator cuff muscles. So the rotator cuff sits over your shoulder like this, but deep down, and they support your shoulder. And often some of this muscle imbalance comes from the rotator cuff not working as well as it can do. So one of the exercises we can help in this early stage is an external rotation, where you have your elbow tucked in by your side, and you're going to be trying to gently take your arm out to the side with the elbow still tucked in, and you can do this up against a wall or use your hand just to gently resist against that. So you're not going any further than what we call this neutral position, and you're gently pushing out into that area. Now, combined with our other exercise where we've got that shoulder blade back, you want to try and keep that there whilst you're doing that push out to the side. And it's just a gentle one to start off at about 20 or 30% of what you would be a maximum contraction. And then as you get better at that exercise over the coming weeks, we can make that more forceful, up to sort of 60 or 70%, and then start to add in weight. But you need some advice from your physiotherapist about when to progress that. So thank you for watching today. Hope it's been educational for you. Just a quick reminder, if you're getting pain or any discomfort with the exercises, and it probably means that you need to discuss that with your physiotherapist, and I'll come in and see one of us here.